How do we diagnose mold toxicity? What I do in my evaluations is certainly I always ask, because again, it's so common with brain-related symptoms, I always ask about exposure to water damage, and this could be stains on the ceiling, windows that show damage. It could be a roof leak. It could be water intrusion that comes near entry for a fireplace. It could be a damp basement. It could be a dorm room. They're notorious for having mold. I've seen many young people go off to college fine and develop mental health issues in college and found they had mold toxicity. Also, school settings. Very common, if you look, there will be stains on the ceiling tiles from leaks in the pipes. And also be important to know someone's timeline. When did they have known exposure and when were the onset of their symptoms? Now, it doesn't always fall out such that someone has exposures and then their symptoms started. Sometimes people have had exposures over time and their symptoms sort of escalated with that. Sometimes people come into the world with mold toxicity, and as young children had ear infections and high immune reactivity. Maybe they had croup or asthma, and that could have been the beginning of their evidencing mold toxicity. But then maybe it wasn't diagnosed until later in life. Aside from history and timeline and symptoms, we also do what's called urine mycotoxin testing. The one that I use is the real-time mycotoxin test, and this measures ochratoxin, aflatoxin, trichothecenes, gliotoxin, and zearalenone. And though those aren't all the toxins, that gives a pretty good picture of if someone has mold toxicity.